my presentation that I had happened to deliver in Islamabad, I had focused two things basically. That what are the factors that are leading us to a state of mental health in terms of vulnerability for the populations of Balochistan. And the second part was what would be the psychosocial stabilizing factors that can work in case of Balochistan. What can be done in that area? When we presented that Balochistan in terms of the psychiatry services, that we say that working percent of the population is affected and they require pure medical care from psychiatrists. That figure 2 was shocking for me in the beginning. And then I realized the figures when I went to the contributing factors leading to a state of mental health. And that was 20%. When we say 20% means 3 million of population of Balochistan needs psychosocial support at this point of time. And the coverage that we have is not more than 5 districts in all over 36 districts of Balochistan. And that too is concentrated at Quetta and 2-3 other districts are, let's suppose maybe we have a psychiatrist at Zolai and Jalawang, Makra. So basically it is concentrated at Quetta and we don't have this support there. So there is a gap. We have population all over Balochistan and we don't have the services. And the contributing factors in case of Balochistan are very serious. The first one is of security, as you all know. We did not dilate upon it very much. We just state one sentence that every one of us and every family in Balochistan has suffered at the hand of terrorists themselves or terrorist attacks and the law enforcing agencies itself, because they are also contributing to this stress upon families. The second was, okay, if I go by the slides of presentation, so this was the picture that we had presented. The second was the economic situation, in which we say, as Dr. Asma said, that as per multi-dimensional survey, 70% of our population are multi-dimensionally poor. And that is a serious problem for families struggling with their livings. That is contributing to the stress very seriously. Apart from that, that indirectly then comes to the health indicators that affect health indicators. That is why our maternal mortalities, infant mortalities, nutrition and other figures are very pathetic in case of Balochistan, and that is affecting national figures as well. And this is the human capital index is very important in this sense, that our index is at 0.34. It means this fraction of population are unable through their lifetime in terms of cognitive abilities and physical abilities. They cannot become a very good sportsman and a like that. It is not possible at all that they will be able to utilize their mental capacity. Coupled with lack of education facilities, coupled with lack of health facilities, you can easily imagine the pathetic condition that Balochistan is facing in our days. And that figure, 15.3, is again very important. That must be a new thing for Dr. Asma as well, that our revenue is heavily invested in the health facilities that people receive. So their out-of-pocket expenditure is more than 10%. When it is more than 10%, it means it enters the catastrophic expenditure on health. So that is, it means 10% of their revenue, the earning that they are earning, is going to the health facilities. Health card is there, that is we are trying to control that through health card, but this is at the ground affected. Now, when we come to the livelihood, 43% of population you can see is dependent upon daily wages. And in our case, agriculture is shrinking, climate change is there, and the rains we have that turns into flash floods. So things are not sustainable in that house. People have sold their wood of their apple trees for firewood. And this has happened throughout Balochistan. Even my village is not an exception to this. And then you can see We don't have any other sector, services sector, or industrial sector, or any other. So where can people get their wages, daily wages? One transport sector, we have a small fraction. That too is under stress. Every other day you can see transporters blocking the road because their trucks are being burned on the highways due to the poor security situations. And the last is the public sector employment. 19%. People consider it a sustainable, a lifelong livelihood support system, a social support system. That is why they are dying for public sector jobs. They even can sell their assets to get a job there. This is not going to work. Then coming to climate change, I have discussed about it. That is coupled with flash floods like nowadays we are seeing. And today have we a forecast for Balochistan as well. So God forbid we do not see such episodes again in Balochistan. And then we have earthquakes. We have regularly seen this phenomenon in Balochistan that really affect families badly, and the decreasing water table that I discussed. Now coming to this refugees influx and their exodus now, we had included this point as well in our presentation at Islamabad. Then when refugees were coming to Balochistan in 80s, Dr. Mashur might be witnessing this, they had given us a stress because they had brought arms with them, they had brought drugs with them, they had brought crimes with them. That was a change that society had very difficulty accepted or learned to live with it. Now the same is the problem with their exodus because their second or third generation have learned to live with us. They are our labor force in agriculture. They are our labor force in construction industry. And if they exit, that is again giving us a setback to our economy. The real estate of Quetta, as you all know, has collapsed for the last 3-4 years because of the fact that they were the property owners in Quetta. If they are going out, this bubble of property boom has blown up. So no one in this hall can tell me that which of the society or the construction scheme is doing well. Even DHA is unable to construct a single home from the last 10 years. So this is again giving us a very tough time. The last is the narco economy. As you all know, maybe since you are, Balochistan, but this will be shocking for you that the opium that has been cultivated this year in terms of quantity is more than that used to be cultivated in Afghanistan. This whole opium industry has shifted to us. And it is not only the cultivation. Even the processing of the concentrate of the opium is being carried out just 60 kilometers away from here. I don't want to name the place of that opium factories where we are purifying crystals and so many things. The name of the products are even difficult to know. This is happening in Balochistan. And this is going to seep in to our culture. This is going to seep into our society. And this has happened to many nations in the world. Even China is famous for that. Even Singapore is famous for that the whole of their nation were opium-ridden and many other addiction-ridden. And we were kind of saved from this due to our culture or whatever. The reason was maybe the unavailability, but it is not anymore. I'm sorry to say that educational institutions now and other institutions, you can easily find anything you want in those institutions. For how long we will be able to keep ourselves safe. One other factors that I should have included was, or rather, is the social media. Social media is giving us tough time in a sense that we are such kind of people that we don't believe in research. We are not socially media literate people. In our case, we consider perception is stronger than reality. We don't go for reality. Whatever we find on social media, we started believing it, we're following it, we even started sharing it with one another. And that is giving us, again, some sort of anxiety. And that anxiety in long run turns into depression and so many other social problems. And this is what I believe this social media is playing havoc with us. It has to be regulated somehow. It has to be rather stopped because we are the people that we will never learn how to use social media. That is affecting even children. If I were given a chance, I would stop the use of social media for the children till the age of 16. Because we have now artificial intelligence. The moment one can use social media, even especially your children, that device itself will turn off that if it is not used properly. So there are techniques we have to deal with it. So these are the factors that are contributing in Balochistan, and that is why now it becomes understandable that why figure in case of Balochistan is 20%. This is justified. In the middle, you can see we have a rising trend of suicides as well. Yesterday, we were calculating that this figure is now more than 1,500 per year in case of Balochistan and more than 15,000 in case of Pakistan. That too is reported. The cases, those are not reported, are still dark figures for us that we don't know. So in a province like Balochistan, we have this trend now coming up. And these are the factors that I just explained on the previous slide that is contributing to it. And the services I explained already that it is concentrated at Quetta and we don't have in other provinces of Balochistan. And some of the initiatives that have been taken up in silos, you can see in different years, different development partners have helped us in Jafarabad in 2021 and then in trauma emergency services after the earthquake of Hanai. And then you can see the relief response in 2022 and then PPHI and UFPA do some capacity building upon stigma. In our culture, we do not bring a patient to any clinic or doctor unless he shows some special signs. So how we are going to draw a line. Secondly, our ad, since there is a stigma on it, people might think that I'm being registered upon the app. My name is going to be reflected there. So I think we have to put in some sort of provision in that your details are your name and other details will be kept within this software. It will not be highlighted or shared with anyone. It is only for your benefit. ये सिर्फ आपके फायदे के लिए होगा, आपका नाम कहीं शेयर नहीं होगा, किसी के सामने नहीं आएगा. So this we have to take care of very seriously. दूसरी बात ये है कि डिमांड एंड सप्लाई के साइड पे तो है क्या, ठीक है, हमने प्रोविजंस नहीं प्रोवाइड की, अभी करनी पड़ेगी एट एनी कॉस्ट अगर हमें मेंटल हेल्थ के इश्यूज को देखना है. लेकिन डिमांड साइड पे हमदर्द फोर्स एडवोकेसी के सेंस में कितना इफेक्टिव होगा वो हमें देखना पड़ेगा. उसके लिए हमें एडवोकेसी के अप्रोच को थोड़ा सा स्पेशली डिजाइन करना पड़ेगा कि सोसाइटी में ये बात काम हो जाए. अब यहाँ पे तो ये है कि घर में अगर बड़े साहब गुस्सा हो रहे हैं और वो ठीक भी नहीं है तो किसी की जरूरत तो नहीं है ना मजा ले कि उसको ये कहे कि आपको डॉक्टर की जरूरत है. और अगर ऑन द अदर हैंड अगर कोई खातून कहे कि उसको रियलाइज हो कि उसको जरूरत है तो ये भी वो कहता है कि नहीं तुम ठीक हो. तो ठीक है, ये सॉफ्टवेयर तो गिव्स यू एक्सेस. आप देख सकते हैं मेंटली माई केयर ऐप के थ्रू असेस कर सकते हैं कि मुझे रिक्वायर्ड है या नहीं, या तो वो अपनी शोहर के सिम्टम्स भी तो डाल सकते, घर के किसी और के सिम्टम्स भी तो डाल सकती है, अगर कोई और फर्क भी डाल सकता है. बट स्टिल एडवोकेसी पैनल हमें चाहिए होगी. वो किस तरह होगी मुझे नहीं समझ आती. यू आर द एक्सपर्ट्स ऑन ट्रेड कि वो हमें किस तरह करना पड़ेगा. मल्टीमीडिया के थ्रू जाना पड़ेगा, सोशल मीडिया के थ्रू जाना पड़ेगा, मल्टीपल फैक्टर्स हैं उसके. प्रिंट मीडिया अब उतना इफेक्टिव है या नहीं है ये चीज़ देखनी पड़ेगी. मेंटल हेल्थ लेजिस्लेशन यस गैप है, हमें उस पर आना पड़ेगा. एक्ट भी पास हुआ है, एक्ट को भी दोबारा चले, अच्छी मेहनत हुई है, एफर्ट्स हुए हैं डॉक्टर गुलाम साहब के दिनों में एक्ट भी आया है. तो सर हमें थोड़ा सा एक्ट को भी दोबारा देखना पड़ेगा. इसी से रिलेटेड जो अथॉरिटी बनी है वो भी उस तरह रोबस्ट भी फंक्शनल नहीं है. अथॉरिटी की कंपोजिशन को दोबारा देखना पड़ेगा. और इनके अलावा मेरा ख्याल ये है कि जैसे सुबह डिस्कस हुआ है कि हमें एक कोऑर्डिनेशन कमेटी भी बनानी है और वो कोऑर्डिनेशन कमेटी इन सारी चीज़ों के लिए फैसिलिटेशन और कोऑर्डिनेशन का काम करेगी, जिसमें साइकियाट्रिस्ट भी होंगे, हेल्थ डिपार्टमेंट से भी होंगे, एक दो डिपार्टमेंट्स और होंगे, डीजी ऑफिस भी होगा कि ये कोऑर्डिनेशन उसके लिए कर सके. और उसमें हम चाह रहे हैं कि एक आध बंदे ऐसे आ जाए कि वो उसके चैंपियन बन जाए, वो उसके एडवोकेसी कर सके, उसका कोई फेस वैल्यू हो. अगर ये सेटअप हमारा रहेगी ना तो हम ये सिस्टम ऐसा कोई इन प्लेस कर सकें कि वो उस अगर पे या उस डायरेक्शन पे चल पड़े और वो उसके ऊपर चीज़ें ले जा सकें। तो इसके अलावा भी जो आपके 2 दिन की एक्टिविटी है, और भी तजावीज़ और भी सिफारिशात सामने आएंगी, तो वी विल टेक केयर ऑफ दैट। हमारी टीम आपके साथ है, हमारी डायरेक्टर टेक्निकल डॉक्टर रोशनदा आपके साथ रहेंगी थ्रू आउट द सेशन दैट is being planned for today and tomorrow। तो ये चीज़ें हम इकट्ठे कर लेंगे, तो let's give it a serious try। हम इस वे में काफ़ी काम कर सकते हैं, काफ़ी काम हो चुका हुआ है, चीज़ें सेट हैं, इस साल रिसोर्सेज हमारे पास अवेलेबल हो गई हैं। सीएम साहब की बहुत मेहरबानी है इसमें, और मिनिस्टर हेल्थ ने बहुत इंटरेस्ट लिया है, तो गवर्नमेंट का इसके ऊपर बाइंग भी है, इनका विजन भी है कि जी ये काम हमें करना है। तो आप ही इस फील्ड के और इस डोमेन के लोग हैं, हम लोग तो चेंज होते रहते हैं, आपने ही इसको ऑन करना है, इसको आगे लेके चलना है।